I have a question for you. How many health protocols have you started in the last 2 years? Maybe you were given a diet plan, maybe you were given a new supplement stack, whatever that is. And now ask yourself this. How many of those things are you still doing consistently today? And if the answer is less than half, you are exactly like most people, and that is not because you're lazy. I'm Dr. Thomas Pawlowski. I'm a longevity physician, and I design comprehensive, personalized health protocols for my patients. I will now tell you something most doctors do not say out loud. The biggest problem in longevity medicine is not a lack of knowledge or a fancy protocol. It's that most people are not effective at sustaining the protocol they start. I call this the protocol paradox. And once you understand it, I promise you will think about your health very differently. Now, let me explain why this happens and how you can fix it. So the more comprehensive your health protocol is, the less likely you are to follow it. It's that simple. And I see this all the time in my practice with my patients. You know, a patient comes in, they're motivated, we run all the advanced labs possible, we review biomarkers, we build a plan across nutrition, exercise, sleep, you name it. On paper, the protocol looks excellent. But 6 months later, there's no change. The patient comes, says, "Doc, I'm not taking this, I forgot to take that." Not because the plan was wrong, not because the patient did not understand it, but because the protocol demanded more than their real life could actually absorb. So the failure does not happen in the clinic, it happens after the visit, when the patient goes back to work, to their stress, travel, family, and all the friction of normal life. The protocol was built for the ideal version of their life, but they live in the real one. So there are three main reasons why the protocol paradox happens. One is that life is already complex. When your morning routine needs 20 supplements, breath work, journaling, cold exposure, workout at 8 a.m., this is not a health system, this is a second job. And who needs a second job? Number two is limited bandwidth. Every human being has limited bandwidth. Work, family, energy, sleep, stress, relationships. But when a protocol demands more capacity than a person actually has, something breaks. And usually this is your protocol. And the third is your identity gap. Most health plans are prescribed from the outside. Do this, do that, stop taking this. But real behavior change does not come from instructions alone. It comes from identity, an identity shift. You do not stay consistent because someone else told you to. You stay consistent because you start seeing yourself as the kind of person who lives that way. So what is the solution? How can you escape this protocol paradox? There are three principles that you can follow. One is subtract before you add. So the first question is not what should I do to my routine? It's what should I remove? What is taking energy, attention, and time without giving enough back? Most people do not need more interventions, they need fewer things done more consistently. Number two is sequence, do not stack. So do not launch 15 changes all at once. Ask your doctor to prioritize and introduce one behavior at a time in the right order. In my practice, I use, for example, the framework called MEDS, mental health, exercise, diet, and sleep. And I tell my patients to start with mental health first, exercise, then diet, and finally sleep. Number three is build the identity first. So before you put yourself through all the diagnostics and health tracking, ask yourself, who do I need to become to actually sustain what I find? Are you the CEO of your own health? Or are you letting every new podcast, trend, or expert make the decisions for you? So to conclude, the protocol paradox is one of the most important concepts in longevity medicine, and almost nobody is talking about it, because a simple plan you can actually follow beats the perfect plan you will quit. So in the next video, I'm going to break down the framework of MEDS, mental health, exercise, diet, and sleep, and I will give you a key explanation of why mental health is so crucial for making sure this whole system is optimized and making you live a better, healthier, and happier life.